जी वैलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल के उत्ते। सो स्टार्ट करते हैं फर्स्ट क्वेश्चन हैगा फ्रॉम बर्थ टू 1 ईयर ऑफ चाइल्ड डिवेलप सेंस ऑफ ट्रस्ट वर्सिस मिसट्रस्ट अकॉर्डिंग टू। सो द क्वेश्चन सेज फ्रॉम बर्थ टू 1 ईयर ऑफ child develop sense of trust vs mistrust according to dash Erikson, Freud, Simon, none of these. So the right answer is option A, Erikson. Next हैगा question number second. The pediatric drug dosage can be calculated by based on body surface area, disease condition, both A and B, none of the above. So pediatric drug dosage can be calculated by based on body surface area. So option A is the right answer. Next, third, clerk rule for pediatric drug dose dash age in month into 13 years, child weight pounds into 150 into adult dose, none, all of the above. So clerk rule for a pediatric drug dose, right answer is option B, child weight pound and into 150 into adult dose. This is a clerk's rule for pediatric drug dose formula. Option B is the right answer. Fourth, the following is the oral rehydration solution prepared at home. 5 teaspoon of sugar, 3 tiger pinch of salt, 1 liter of boiled and cold water, and the last is none of these. So following is the oral dehydration solution prepared at home. So the right answer is none of these. इन्हां चों कोई नहीं हैगा। oral dehydration solution ਨੂੰ prepare जे आपां घर विच करना होवे तां इन्हां चों कोई option नहीं हैगी। So option D is the right answer. During the CPR for infant, the rate and volume of breathing 20 breaths per minute, 6 breaths per minute, 20 breaths per minute per 2 minutes, and none of these. So during a CPR for infant, the rate and volume of breathing is, the right answer is none of these. Option D. 6. Following is the example of inherited disease: anemia, heart disease, hemophilia, none of these. So option C, hemophilia is an example of inherited disease. Option C is the right answer. Next, seventh, the clotting factor that lack in the hemophilia dash factor 8th and 9th, factor 1 and 2nd, factor 2nd and 3rd, none of these. So clotting factor that lack in hemophilia is a factor 8th and 9, option A. Next, move to the 8th, the term newborns refers to. So what is the term newborn refers to? From birth to 1 year of age, from birth to 1 month of child, from birth to 1 week, none of the above. So the right answer is option A, from birth to 1 year of age. Option A is the right answer. Next to question 9, the common site for nose bleeding in childhood: nasal septum, posterior nasal septum, anterior nasal septum, none of these. So anterior nasal septum is a common site for nose bleeding in childhood. Option C. Next, 10th, in WHO recommend ORS the amount of glucose 10 gram, 20 gram, 15 gram, 25 gram. So in WHO recommend ORS amount of glucose 20 gram. Option B is the right answer. 11th, to treat a severe dehydration, the immediate responsibility of a nurse. So in a condition to treat a severe dehydration, what is the nurse's responsibility? Start IV fluid with RL, give blood expanders, give only, and next is third option is give only oral fluids, none of these. So in a condition treat severe dehydration, immediate responsibility of a nurse, start IV fluid with RL. Option A is the right answer. Next, 12th, teach mother to give ORS after each loose motion. So A, 50 to 100 ml of ORS of a child less than 2 years old, 100 to 200 ml for children, all of the above, none of these. So teach mother to give ORS after each loose motion, provide all of the above. 52 ml of ORS for a child less than 2 years old and 100 to 200 ml for all children. So option C. Next, 13 phalloid tetralogy in children. There are 2 defects in heart, 4 defects in heart, 3 main defects in heart, none of the those. So in a condition phalloid tetralogy in children, there are how many defects in a heart? So ਇਹਦਾ ਆਨਸਰ ਤੁਸੀਂ ਕਮੈਂਟ ਸੈਕਸ਼ਨ ਦੇ ਵਿੱਚ ਦੱਸਣਾ। ਨੈਕਸਟ ਆਪਾਂ ਮੂਵ ਹੁੰਦੇ ਹਾਂ 14th, child suffering from sore throat and it is not taken care, so after a few weeks the child taken to hospital by the parents with complaints of hematuria fever. The condition of the child may be glomerulonephritis, appendicitis, nausea, none of these. So child suffering from sore throat, it is not taken care, so few weeks the child taken hospital by the parents is the option A. Glomerulonephritis option is the right answer. 15th, the factor responsible for successful fertility is healthy motile sperm, sperm transport, healthy ovum, testosterone. So the right answer is testosterone, option D. Next, 16th, requirement of feeding of the newborn on the first day birth is 60 kg, 80 kg, 8 ml kg, none of these. So requirement of feeding of a newborn on first day birth is 80 kg. So option B is the right answer. Next, 7th, lobar pneumonia are common in among children of 2 years old, children of 6 year age, no age limit, none of these. So lobar pneumonia are common in among children of 2 years old. 18th, the endotracheal tube size of newborn is Hanji, lobar pneumonia are common in among children of 2 years old, children of 6 years of age, no age limit, none of these. So lobar pneumonia are common in which age of children? Among children of 2 years old. So the right option is A. Next, 18, the endotracheal tube size of newborn is of size 2, 2.5 and 3 mm. Next, of size 4, 4.5 and 5 mm. Next, any size can be used, and D, none of the above. So endotracheal tube size of newborn is of size 2, 2.5 and 3 mm. So option A is the right answer. Next, 19, the nasal bleeding otherwise is called throat bleeding, nose bleeding, epistaxis, none of these. So nasal bleeding otherwise is called epistaxis. Option C is the right answer. 20, the main aim of nutritional program to provide 500 calories plus 25 gram of protein per day. Next, to provide 300 calories per 12 gram protein per child per day, 2 to 6 years. By calories plus 8 gram protein per child below 2 years per day, all of the above. So the main aim of nutritional program is all of the above. To provide 500 calories plus 25 gram of protein. Next, provide 300 calories plus 12 gram protein per child per day, 2 to 6 years. And last is 22 calories plus 8 gram protein per child below 2 years per day. So option D all is correct. ਸੋ ਇਹ ਕੁਐਸਚਨ ਸੀ ਜਿਹੜੇ ਅੱਜ ਆਪਾਂ ਕੀਤੇ ਆ, ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਨੇ ਇਹ। ਸੋ ਸਾਰੇ ਜਣੇ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਆ ਕਰੋ। ਮਿਲਦੇ ਆ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ। ਓਕੇ।